What is going on, guys? This is HG Performance Chiropractic, and I'm going to show you exactly what I would do if I was experiencing rotator cuff pain. Check it out. If you're experiencing shoulder pain, definitely get with a provider, chiropractor, physical therapist, medical doctor, doesn't matter, just get evaluated to see what is going on and what you can do to fix it. If it's just residual soreness and you feel like you can work on it at home, I recommend getting a massage gun and working through that spot either by yourself or with somebody else. I always start with a little bit of mobility and then I work towards strengthening. So I want to make sure that I do have a good range of motion in my shoulder, internal rotation, external rotation, abduction and adduction, and of course flexion extension, which usually those are not limited. But if you've got shoulder pain, most likely you're either limited in internal or external rotation. You can have trigger points in the back of the shoulder that do refer down the shoulder just a little bit. It won't refer all the way down the arm. That would be more of a nerve issue, but you can have a referral of pain pattern down the shoulder a little bit. So there are 4 different rotator cuff muscles. There's the supraspinatus, infraspinatus, teres minor, and the subscap. The most commonly injured is the supraspinatus, but the typical pain presentation is down through the back of the shoulder, like up through here. Should feel a good stretch on the back of that shoulder. Try not to come up, stay down all the way, and just go as far as you can. You're going to have a thumb towards the ceiling. You're going to go up into an I, up into a Y, and then up into a T. You're going to grab a ball or a can of some sort. You're going to lay on your stomach. You're going to be here. And you're just going to drop and catch. You're going to keep the paper towel tucked underneath the arm. You're going to grab the resistance band, and you're just going to do external rotation, keeping that towel in between the arm. The next one you're going to pull back. Keep the arm up at 90. These are just things that I would do if I was having shoulder pain and what I would do to fix it.